Why is a doll company giving your daughter dangerous medical advice? Why? You might have seen the headlines about a recent children's book from the doll company American Girl. American Girl has been around for a while, and they started by producing characters that taught girls about different cultures and historical eras. Among the other books they produce is the Smart Girls Guide series. The target age is around 10 to 12, and it includes some really helpful topics like manners, middle school, money, and most recently, body image. The book helps girls figure out what is real life and what are messages from social media. And it tells girls to embrace all of the unique things about them. The color of their skin, that's great. Their size and shape, also good. Cellulite. I actually do wish someone would have warned me about cellulite. It sneaks up on you fast. The book is all about body positivity and embracing yourself as you truly are. American Girl says that the whole point of it is to help girls learn to live comfortably in their own skin, loving her unique self and appreciating her body for the life that it lets her live. What could go wrong? But tucked on page 36 is a section on gender. And not just gender joy. Now, from what I can tell, this is the only time in all of these subheadings that the word joy appears. Everything else is about self-acceptance, being positive, loving your body. But when it comes to gender, it talks about joy. And the subtle implication here is if you don't feel joy at being a girl, well, maybe that's because you aren't one. Here's what it says. Most kids grow up feeling comfortable in the sex the doctor assigned, but for some, that assigned sex doesn't match who they know they are inside. So in a book on body image is a section telling girls that if they don't feel joy at being a girl, there's a pill for that. And not just any pill, a puberty blocking pill. Doctors bill this as a safe and fully reversible way to press pause on puberty. One of the most common puberty blockers is a medication called Lupron. Lupron started out as a drug to treat aggressive forms of hormonal cancer, and it arrested the production of a hormone so that the person had a chance at surviving. In other words, it was a drug intended to heal. Eventually, it was prescribed for other things like endometriosis, and that has had some disastrous effects on women who took Lupron for endometriosis. Most recently, puberty blockers have been prescribed to children expressing some form of gender dysphoria, but they're neither safe nor reversible. In fact, the side effects are so prevalent that children's hospitals and even our own government is trying to catch up to correct the data that has been put out there. Some things that puberty blockers do to children: higher risk of stroke, decreased bone density, and brain swelling. In July of 2022, our own Food and Drug Administration, the FDA, found that puberty blockers cause both brain swelling and vision loss in children. This is all while gender therapists, gender activists, and even some officials in our government include puberty blockers as a medically necessary, life-saving aspect of gender-affirming care. So here's a question for American Girl and its parent company, Mattel. Why are you encouraging children to consider medication that our own government admits can permanently and seriously harm them? And why are you doing it in the name of body image? It's little wonder that gender dysphoria has so exploded among teen girls. The slightest expression of awkwardness or body consciousness is interpreted as unrealized trans identity. To be honest, who felt gender joy as an 11 and 12-year-old? It was middle school. It was awful. American Girl is just one of many companies pushing this narrative on children, and it's even more alarming when you consider the link between gender dysphoria and peer influence. Teen girls are highly suggestible. That's why you find their behavior influenced by social media, by friends, and by things that they read. So here's a great way to help girls be more confident in their bodies. Stop telling them they're better off being boys.